everyone. This is Dr. Gamble coming to you from Sedona, Arizona, with information about thyroid medication. So, I had a friend who asked me about, looking at her labs and such. And so I did for her. And I noticed that her thyroid hormone was out of control. It was elevated in her case. So I asked, what's going on with this? Are you on thyroid medication? She's like, well, yes, I've been on it for years. And I was like, well, why is this number, looking the way it is? And she responded that, it's always been that way. It's always out of control. It's never normal. So I asked her, how is she taking her medications? And she said, oh, sometimes, I remember it late in the afternoon, or sometimes I forget it and then I just take it the next day, that kind of thing. So I, had a conversation with her about that and gave her some information that I'd also like to share with you that will hopefully, if you're having this problem with your thyroid hormones not being in control, this will help. There are lots of symptoms that go along with having hypothyroidism, which is a result of elevated thyroid hormone, right? So here I'm going to just share a little bit of information about thyroid hormone and how managing it properly and taking your medications properly will actually be beneficial to you. So the big question is, why is your thyroid hormone abnormal to begin with? So here in the US, what we find is that the number one cause of hypothyroidism is an autoimmune thyroid disease known as Hashimoto's. And so worldwide, it's a little bit different. It's caused by iodine deficiency. And so that's the number one cause worldwide. But here in the US, the number one cause is an autoimmune disorder. So hypothyroidism is defined simply as your TSH, your thyroid stimulating hormone, being elevated. And so you see the normal values there, in conjunction with your T4 hormone being lowered. Now, is this an indication of every single time you see these labs and they look this way, it's absolutely hypothyroidism? No, that is not what I'm saying. It's more complicated than that. However, this is the majority of what is seen is the Hashimoto's thyroiditis, which is the number one cause for these labs in the US. Your doctor, who will see your entire list of labs, will be able to make the diagnosis. I am not making any diagnosis of anyone's labs right now in this video. So what are some treatments for hypothyroidism? We have three main ones: levothyroxine, liothyronine, which is used pretty rarely, and then thyroid desiccated, which comes from an animal thyroid that is desiccated or dried out, and then crushed up and put into pills. It's a natural form of T4. Levothyroxine is a manufactured form, a synthetic form of T4. So the one most common is levothyroxine. And that's most likely if you've been diagnosed with hypothyroidism, right? Because of those labs that I just showed you, you're likely taking levothyroxine. Like 99% of the time, you'll be taking levothyroxine. Okay. So for the people who are taking levothyroxine, I wanted to give you some information that I found online, of course. But I mean, these were in books, right? When we studied in med school, but the guidelines on how to take levothyroxine, right? Because it's not a regular medication that you can just take whenever you want. So the guidelines show, let me see if I can make that visible there. The guidelines show for oral administration, you should take the tablets with a full glass of water, preferably 30 minutes to 1 hour before breakfast on an empty stomach. So that's before your coffee, right? Before you've had anything to eat, before you're taking your other meds, right? You're taking this levothyroxine all by itself with the glass of water. That's the guideline, okay? So again, I'm not making any recommendation for anyone to change what they're doing. I'm only reading to you what the guideline says, quoting directly from Medscape here. So what exactly does that mean now that you have that information, right? Now that you know, knowing is half the battle. Sorry for those of you who aren't familiar with that cartoon. That was kind of one of our favorites growing up. But if you are not taking levothyroxine according to the guideline that I just showed you, the next thing for you to do is call your pharmacist or call your doctor, okay? Call your pharmacist and say, I heard this internet doctor, Dr. Lena, saying that the guideline for taking levothyroxine is different than what I've been doing. Can you give me more information? What do you suggest that I do? Why am I telling you to do that? Because your pharmacist, your healthcare provider, your doctor, they are going to have your records, right? They know more information about you than I do, because I know zero information about you, right? Like, they are going to make sure that the guideline applies to your situation, right? Now, of course, it applies in 99% of the cases, but I don't know your case. Call your pharmacist, ask them if that's what you should be doing in your case. I put pharmacists before your healthcare provider simply because, number one, the pharmacist has more time. Number two, every pharmacist I've talked to said that they like getting these questions and they don't get them enough. So let's make our pharmacists happy. Give them a phone call, ask them what you should be doing, okay? One second. All right. So now that you have this new information and knowing is half the battle, you should just start taking your thyroid medicine first thing in the morning, like Dr. Lena said, right? No, that is not the answer. That is not the answer at all. Dr. Lena is not telling you to change your medication. Please understand that's not what's happening here, okay? What I am doing is giving you information, right? Sharing guidelines with you, making sure that you are informed about the medication that you're taking, so that you can make an informed decision in conjunction with your healthcare professionals who are taking care of you. Okay, that's what I'm asking you to do here. And just to reiterate, I want you to call your pharmacist or call your physician or your healthcare provider so that they can discuss with you whether or not these guidelines apply to your care. The goal is to ensure that you can have the correct conversation with them so that your health and wellness are better overall. I do hope that helps. Let me know in the comments if you have any questions. Have a good day.